seriously. Oh. Hello, my name is Gabriella Santanella-Small. I represent Breaking Barriers, an interpreter outsourcing company. I'm here to tell you how your patients and your healthcare system can benefit from our services. 21 million Americans are classified as having limited English proficiency. This means that they cannot read, write, speak, or understand English on a functional level. Between 1990 and 2000, the number of LEP patients increased from 14 million to 21 million. Although the results from the 2010 census are not available, it is likely that this number has significantly increased again over the last decade. What does this mean for the healthcare industry? It means that 21 million patients are potentially receiving inferior care to those that are English proficient. It also means that healthcare providers are more prone to malpractice due to incorrect diagnoses. It also makes your job more difficult by trying to communicate inadequately with these patients. Using professional interpreters is preferred to using ad hoc interpreters. Ad hoc interpreters are bilingual family, friends, and other untrained third parties. The National Council on Interpreting in Healthcare suggests a minimum of 40 hours of instruction on medical terms, interpretation skills, ethics, role-playing, and cultural awareness. Ad hoc interpreters do not have training. Many have no medical knowledge at all. You cannot be sure the patient is receiving an accurate translation of their condition or treatment. You also cannot be sure you are receiving accurate symptoms or history. For example, if the family member is abusing the patient, they are not likely to provide this information to you even if the patient is willing. Professional interpreter services is not an exact science. Time constraints can be a problem, especially if the staff is unaware of the need beforehand. Patients also may not always feel comfortable talking about or asking questions about their health issues. The staff's lack of knowledge of the interpreting process can also cause problems. How can healthcare professionals overcome these pitfalls? There are simple ways to avoid common problems with using interpreters. Having readily available interpreters can help with the time constraints. It is important for both the staff and the interpreter not to act rushed, even if they are. This can cause the patient to be uncomfortable and avoid asking questions or giving important information. It is also important for the doctors to show interest in the patient's culture and show tolerance for their alternative treatments if applicable. It is unreasonable, of course, to expect them to be experts, but building a relationship with the patient can increase their comfort with talking about their condition and symptoms. The staff must also understand that word-by-word translation is nearly impossible and that it can take a little extra time to translate complicated medical terms, concepts, and diagnoses. What does this mean in terms of cost? It can cost as little as $4.04 per visit to retain professional interpreters. Medicaid averages annually per patient $1,957, $1,565, and $2,328 for mood disorders, diabetes, and heart disease respectively. Their average annual cost per patient for interpreters is only $279. Incorporating the cost into operating expenses is also an easy and economical solution. In conclusion, the benefits of professional interpreters can provide to patient care far outweigh the cost. While there are imperfections, most are easily avoided with minimal knowledge and training. They are also less risky than the potential problems of ad hoc interpreters. Thank you for your time.